Since the idea is to try and build more muscle, the technique that you do is very, very important. Now, most people think that the muscle building benefit comes from the actual peak of the contraction. That's not the case. It comes from the real depth of it. Stretching out those muscles at the bottom, nice, safe, slow pause there. That's where you're going to get most of that stimulation to the muscle tissue to rebuild and grow.
Exercise is one of the most detailed and variable pillars in cancer prehabilitation. But it's also one of the most important tools we have for improving treatment outcomes and reducing side effects along the way. My name is Dr. Alex Watson, and I get people ready. I'm a double board-certified physician in physical medicine rehabilitation and obesity medicine. I take this expertise in metabolic and rehabilitation medicine, and I help patients prepare for major medical procedures. In this series, I'm sharing my best insights for prehabilitation before cancer treatments. And I'm also giving away the cancer prehab chapter of my book for free down below. My only minor request is that you give this video a thumbs up and subscribe so you can see when the next video in the series is released. Don't worry, they are all filmed. This is not going to be one of those channels that can't finish what it gets started. This is part 5 in a full series on cancer prehabilitation. So you can swing back to the rest of those after we break a sweat on this one, laying out a full plan of attack. Check this out.
This is not that kind of channel. The whole premise of prehabilitation is to address risk factors ahead of time that can cause worse outcomes during cancer therapies. So if you can identify these risk factors, it makes it a lot easier to systematically reduce any sort of negative outcomes and become that cancer-fighting gladiator. So the first of these contributions is going to be physical conditioning. The idea here is that the better your conditioning ahead of time, the more you can take a temporary reduction in that and still be quite able-bodied, independent, and just generally feeling well. So the two main focuses in that area are going to be strength, muscle mass, and then of course aerobic conditioning. We'll get into more about that later. Now, any way you look at it, exercise is one of the most important aspects of prehabilitation, and it's kind of the cornerstone of the whole program. I usually use a shorthand that nutrition is the most important thing for weight gain or weight loss, whereas exercise is the most important for overall body composition and health. Now, of course, these two have strong interactions, which is kind of why prehab is the way prehab is, very integrated between all the different pillars. But the benefits of physical conditioning from exercise tend to have the largest impacts on outcomes from prehabilitation and the actual procedure or cancer therapy as it is. So the big focus here, and a lot of the other pillars, sleep, nutrition, pain control, are to enhance the benefit you get from exercise, improve your capacity for exercise, motivation for exercise, and then let you get back out there and do it again next time. Why is this such an obsession for me? Not just because I've been, gym rat since I was 17 years old, but increased muscle mass releases anti-inflammatory molecules, is able to store more blood sugar for folks with diabetes or prediabetes. More muscle mass supports bone density and also cushions the bones in case of low bone density in a fall or something like that. So muscle serves as an insurance policy for later when you might lose a little bit during therapies, but it also serves as bubble wrap for the body in the event of a fall or something due to weakness that's temporary, but the impacts of a fall can be permanent. So let's get into the types of exercise programs. To begin with, aerobic conditioning. Now, for those who are short on time, high-intensity interval training can be the fastest way to improve aerobic conditioning, particularly the VO2 max side of things. What that means is that you can quickly improve the amount of oxygen your body is able to utilize, which is really important in conditions like heart failure, lung failure, COPD, things like that, where the body is not quite as able to circulate oxygen and fuel, but the muscles can become more efficient at using those things. High-intensity interval training offers the chance to quickly improve aerobic conditioning, but it's not for the faint of heart. While high intensity is a relative term, your high intensity is probably different from my high intensity, it still can be unpleasant to exercise at this intensity even for short intervals of time. When done correctly, this often resembles about 3 minutes at your highest intensity you can sustain for those 3 minutes, not an all-out sprint because you can't do sprint for 3 minutes, followed by about 3 minutes of a recovery period, back to 3 minutes of high intensity, 3 minutes of recovery, do that for 8 to 12 times, then take a little break. Alternatively, the broad recommendation is take 150 minutes total for the week, divide it into 3 or 4 sessions. Doesn't really matter as much the composition at that point because the research is kind of less clear in terms of what it has to be. I often just divide it between maybe one higher intensity session and the rest of it can be something like a zone 2 pace. What is zone 2 pacing? Become all the rage these days, but basically it's the speed at which you're moving and you can have a conversation. Probably don't want to, but you can sustain the conversation without feeling overly short of breath or having to pause to catch your breath or things like that. This is just below a zone 2 pace. I could technically have a conversation right now. Probably wouldn't want to. That's just about where you want to be on zone 2. This can be confounded by the fact that I'm full and just ate lunch. So I'm going to get winded faster and not due to biochemical reasons here, but instead because my tum-tum's a little full of food and my diaphragm can't open up all the way. But basically, I'm on the treadmill here, high incline, and what it does is it allows you to have just enough exertion to build up lactate in your blood. Little incline, a faster pace. But you basically want to be at a pace where your body is producing and clearing lactic acid, or lactate actually, at a steady pace. Roughly find this to be about when, again, able to talk, don't really want to. And don't do this after you eat lunch. All right, back to it. In normal wellness situations, we recommend about an 80-20 split between 80% zone 2, 20% higher intensity exercise. But that kind of research has not really been done in the cancer prehabilitation population, so we can kind of just lean on that and say it's probably about the same thing. On the other hand, though, we can make an argument that it's more of a 50-50 split in this case, since the benefits of zone 2, more mitochondria, better utilization of fat for energy instead of just using, blood sugar and glucose, that takes time to adapt. Time in the order of months to years. So instead, leaning on the VO2 max side of things with the higher intensity, those changes can happen more quickly. And since prehab, again, is a very short period of time, maybe we lean more on those interventions that stimulate a quicker response. Getting to the strength training. Now, I'm kind of biased here because it's always my favorite kind, and, cardio is what you do walking from the car to the gym. But in reality, strength training is really, really important and should complement cardio pretty well. Strength training is never a bad idea, but in the context of cancer prehabilitation, there are some unique considerations you want to keep in mind here. Since the goal is mostly building more muscle, just the muscle mass itself is very beneficial, like we said before. It's protection for bones in case of falls. It's what stores more blood sugar, releases anti-inflammatory molecules, all that good stuff. You want to focus on rep ranges that will give you more of a muscle stimulation benefit than more on the strength building side of things. So to build more muscle, we're going to focus on a repetition range somewhere in the realm of 8, 10, and up. To get the best of both worlds, maybe focus on the 10 rep to 15 or so range. In normal contexts, repetition ranges of 3 to 5, 5 to 8, that's where you get a nice benefit of strength and, on the latter side, a little more of the muscle building benefit, hypertrophy as we call it. But it takes some time to build that. You can't get the right volume for it, and you're more likely to have a little bit of injury here with those high loads, that heavy weight. Since the idea is to try and build more muscle, the technique that you do is very, very important. Now, most people think that the biggest muscle building benefit comes from the actual peak of the contraction. That's not the case. It comes from the real depth of it. Stretching out those muscles at the bottom, nice, safe, slow pause there. Don't bounce out of it. Go back into the repetition. That's where you're going to get most of that stimulation to the muscle tissue to rebuild and grow. If you are going slowly and you have, baseline healthy enough joints to do so, getting a really nice depth. So on a bench press, coming down as far as you can is actually better for your joints, not worse. We used to avoid those kinds of depths because the concern was that you're going to put yourself at this weak position, and that's going to just predispose you to injury. But if it's going to predispose you to injury, you're probably using weight that you shouldn't be using, or your technique is faltering, whatever that might be. In this case, number one rule is don't get hurt. So keep those weights light at first until you're confident about the rep range and the range of motion and everything. Get that depth, feel that burn there, and then come back up. If you're a novice to strength training, which many people are, that's okay. Stick with the machines. For these intensive purposes here, absolutely the best reward to risk ratio. Free weights are great, really, really useful, but for the sake of just building muscle quickly, safely, and being able to do it again, these will fatigue you a little bit less because you're doing less of the balancing and the control here. Instead, they'll let you get to that nice, just moving that heavy weight back and forth, and that's what you really need to be doing. Now, I want to introduce a concept called blood flow restriction training. BFR, or KATSU as it's also called, involves putting a tourniquet on a limb And this way you're going to stop any sort of venous outflow from that limb. The benefit here is that you're going to have blood flowing into the limb still. The arteries are still going to carry in. You don't want to put it that tight. But by slowing the outflow of blood from the limb, all those metabolic byproducts that you're building up when you're working out, those are going to essentially bathe the muscle and trick those muscle cells into thinking you worked out a lot harder than you might have. This is useful when you have situations where you can't lift heavy weights for a reason other than just not being strong enough. So if it's a factor of you either have a metastasis to the bone in that limb, or you have bad joint for some reason, BFR can be a way of working around that, getting a disproportionately heavier load type effect with a lower load of actual weight moved here. In the cases of cancer prehabilitation, though, absolutely, like everything else here, don't try this without professional opinion. But this in particular may have some specific risks. Because you're slowing the blood from leaving the limb, anytime you have that kind of pooling effect, you may have a higher risk of blood clots. And some kinds of cancers can actually increase your risk for blood clots as well. So you do not want to add one more reason for a clot to form, and that can be quite devastating if it happens and isn't caught in time. However, for some folks without any change in their coagulation there, it can be a nice tool to have when you otherwise wouldn't be able to, really meaningfully lift weight in that limb. Now, one last point on the exercise piece here. Compared to non-cancer prehabilitation situations, keep those sessions short. Something no more than 20 to 30 minutes, if well designed. You want to make sure you're focusing on anabolism, so building muscle, and not catabolism, breaking it down. And excessively long strength training sessions, you start running that risk. And again, short period of time, you want to make sure you're doing just the right things here, not risking any backslides. All right. So I think we should get into some cancer type specific exercise regimen here. So kicking off with breast cancer, strength training in particular, I'm going to focus first on upper limb mobility. Prehabilitation for breast cancer often involves anticipating the changes that might occur with something like an axillary lymph node dissection, where you're taking out the lymph nodes in the axilla, also known as the armpit, and the changes that can happen from that. I'm sure you've heard of lymphedema by now, but in this case, by strengthening the muscles ahead of time and building more muscle, you can offset some of those negative effects. The other piece too is that just the procedure itself and the radiation that might occur, those sorts of things can also affect your mobility in that shoulder blade complex. Most of us have some scapular shoulder blade issues at baseline, just the nature of our computer dominant lifestyles and the way that we all kind of sit like this. And so it's important to first bring those shoulder blades back into a nice position, which involves strengthening the muscles back here and some of the ones that run underneath the shoulder blade itself. So the range of motion exercises are going to focus on flexion, extension, external rotation, and abduction here. So I want to be able to move your arm in full range of motion and that shoulder blade that goes along with it. If you have any sort of shoulder blade issues in terms of control, you're going to often see something along the lines of your glenohumeral joint, your shoulder joint itself, is doing most of the work, when in reality, you want that shoulder blade moving too. That's where a lot of the mobility comes from. Next, you want to focus on pectoral muscle strengthening and stretching. Again, sitting like this often leads to tight pectoral muscles, especially the pec minor in here. That's the one that's underneath the larger pec muscle. And if you don't stretch and strengthen that one, you can have issues that affect the entire shoulder complex because you're pulling your shoulder internally like this and down. Basic stretching maneuvers involve just putting your arm up against something, probably not a microwave, but we have that example, and getting a nice stretch this way. You don't want to be doing it from this part, because while you may get a little pec stretch, you're also going to get a lot of bicep stretch. And while important, that may detract from the amount they're able to get a good stretch on these muscles here. Other sorts of scapular control maneuvers you can do are going to involve something like holding a weight or a cable and pulling it this way. So I'm kind of at a Y-shaped angle here. What that's doing is that's controlling your scapula by strengthening your serratus anterior muscles. Those serratus muscles are the ones that look like ribs on ribs that are right about here. They actually attach here and underneath your shoulder blade. They're what keep your shoulder blade stable when you're doing things like pushing or other sorts of activities that may otherwise cause your shoulder blade to push outwards. It holds it tight against your rib cage. Other important activities might involve strengthening the external rotators of the shoulder, because those are two tiny little muscles. And so you want to have something pulling this way. So a dumbbell in the hand for this is not going to do a lot of good because that's pulling down gravity. You want a cable or a band that's attached over there. And so when you rotate out this way, you're getting the strengthening in the right direction. When you're doing these kinds of exercises, notice there's no gap here in my arm. The reason why is if you're bringing your arm out like this, then you have other muscles doing all the work and the little ones are going to be overpowered. So you want to potentially hold a towel here or something else that you're going to be forced to actually hold while doing that turning, and that's going to force you to really maintain that good form and good posture. The other external rotator of the shoulder is more active when you're in this position. So raise your arm up here without hiking up your shoulder blade. So you're bringing it up here like this. This one can be a dumbbell. Hold it like that. Rotate up, down. I tend to go only to about here-ish. That's where the stretch comes in. Bring it back up. If you internally rotate, can cause a little bit of pain here sometimes. And again, why cause pain if you don't have to in this case? Okay, so core stabilization type exercises here. I tend to avoid things like planks because although pretty good, they're isometrics. In this case, isometrics should be saved for strengthening tendons and ligaments, not so much for building muscle. So instead you can do things like a rollout. That's where you have that rolling wheel and go out like this with your whole body, like that. Back to that axillary lymph node dissection and risk for lymphedema. You want to strengthen your actual arm muscles here. So in most cases, I don't do isolated arm exercises. You're going to get enough work done when you're doing compound movements like chest pressing, work your triceps. Rows will work your back muscles and your biceps. Overhead pressing is going to work your triceps as well. And so doing that, you typically get enough arm work. However, if we're really, really focused on preventing lymphedema later, you might want to build some dedicated arm muscle instead. And by doing that, you're going to essentially have that second heart. Those muscles squeeze that lymph fluid back up the arm and avoid it pooling in the limb. Now, old convention used to say, once you have that dissection, that arm is basically museum quality only. You don't do IVs in there, you don't do blood pressure checks, you certainly don't lift heavy things with the arm. Now we kind of know better. But definitely discuss that with your own team. Don't take it from me. Some things are obviously going to be higher risk than others. The concern with strength training after those dissections was that you might worsen lymphedema. Common sense says otherwise, and now research says too. So in this case, again, focus on those arm strength exercises. Stick to higher rep ranges in this case, so something on the 15 to 20 or higher. And exercises like a good tricep press down could be adequate, bicep curls. If you do a compound exercise but adjust the form a little bit, you can get more of an arm workout in that one too. So instead of a wide grip chin up or chin pull down like this, do narrow grip, and it's going to work a lot more with biceps. The beauty of these is that you're going to be able to have your bigger muscles help you overcome fatigue in the smaller muscles, really giving you a good workout. For pressing exercises, similarly, instead of a bench press like this, bring your hands closer and come in this way, and that's going to work your triceps a lot more than it otherwise would. And again, you can have your deltoids and your pecs help you overpower those triceps. Overall, in summary, when you're going through breast cancer prehabilitation, a lot of your strength training work and exercise work is going to be preventing later declines and later issues with fluid movements. So getting really nice, healthy shoulder complexes here, strengthening all the muscles that control that shoulder blade, and making sure to build as much muscle as you can. That's your goal in this case. Okay, so moving on to exercises for prostate cancer specifically. Inherently, anytime you're working in the pelvis, any sort of urologic surgery, there's a risk for pelvic floor disorders. Now, basic things in this case are going to be Kegels, however you want to say it. The way that you want to think about this one is as if you were trying to stop your urine midstream. You want to squeeze that muscle, those muscles there, hold it for 3 to 5 seconds, relax for 3 to 5 seconds, hold it 3 to 5 seconds, alternate that for about 10 to 15 times in one set, then do those sort of sets 3 to 4 times per day. In doing so, you're going to strengthen the muscles involved with that kind of urinary control, and they do a lot of other functions in that area as well. Now, other things that can also strengthen the pelvic floor as well as give you a lot of benefits in terms of just building muscle mass in your legs are going to be exercises like squats, deadlifts, split squats, things like that. For these, you're working big muscles. So instead of focusing on reps in the range of 15 upwards, think more along the 10 to 15 or 8 to 15 or so. as that tends to be the better way of doing these in terms of just overall fatigue and strength gains and all that sort of stuff. Since you're working a lot of muscle here, focus on rep ranges of between 8 to 15. More than that, and the fatigue to benefit ratio here is just not really going to be worth it, and it's going to be exhausting. You're going to hate it. You're never going to do it again. But by working on those deep squats, really getting kind of hips below the knees, and then going down slowly, a nice pause there, the same way we discussed with bench press range of motion. Get that depth, pause, then come back out of it. Don't bounce. But doing that with control, that's where you're going to strengthen those pelvic floor muscles as well. You also get the benefit of nice, strong quads, hamstrings, glutes, calf muscles as well. And that is going to be very, very beneficial for all kinds of important stability and fall recovery. And of course, storing that blood sugar, like we mentioned before, as you'll have a lot more muscle there to do so. Okay. Now, another concern, and this might not be top of mind, is that if you're going to be needing some sort of androgen deprivation therapy, i.e. something to lower your testosterone, you're going to need to worry about bone density. That's where those squats and deadlifts and things like that come in. But you also want to work on your balance, because what is the bigger factor in bone density? It's the risk of what happens if you fall. So building that muscle will give you a little protection around the weaker bones if they weaken. But then also balance training will prevent those falls in the first place. Similarly, you want to identify any sort of decreased sensation in your feet and work on therapies to improve your foot control and kind of perception in the process. So that might be doing exercises barefoot, or other ways of just increasing your sensory input and then your just general awareness of those things. This way, you're less likely to fall because you can feel the ground a lot better. Number one, build muscle as much as you can, as fast as you can. In this case, that's where you're going to be really leaning on things like whey protein supplements. You want to get that nice gram per pound of body weight. Creatine supplements, you want to get about 10 grams a day, and doing those compound movements for your legs. Lastly, functional mobility. Being able to carry groceries and laundry and go up and down the stairs in your home. Those are important different activities to do because they're going to challenge your balance and your strength in different ways while applying it. And so doing that, you're going to prevent falls later when you're doing those same things. When you're doing prehabilitation for head and neck cancers, so it's going to be things like throat cancer, even thyroid cancer, oral cancers. There are a number of important unique strategies as well. So ahead of time, you're going to, again, want to anticipate any sort of potential deficits later. And a big one when it comes to head and neck cancers and treatments related to these will be reductions in neck mobility. So you want to make sure your neck is as mobile as possible, which, given most of our lifestyles and chronic neck problems, may not be a great starting point for you. So some of these exercises are basic, bringing your chin to your chest and pushing back here almost to get nice control of your neck muscles. But this is also going to be an area of working with those scapular control muscles. So you want your shoulder blades to be appropriately nice and controlled here. So when you're moving, you're not putting extra strain on your neck. On top of that, you want to be able to have as much extension as possible and range of motion in either direction here. The reason why is after a while, if you have radiation to the neck, you may get a little bit of fibrosis, which is going to tighten up those muscles. And fibrosis is really just kind of scar tissue that develops after radiation. Other related exercises will be different swallowing exercises. Similarly, you may have some sort of swallowing difficulties, either directly due to structural changes, again, surgical or something fibrosis related, or neurological changes, which can happen more on the longer term side. Radiation-induced neurologic changes to peripheral nerves or we call cranial nerves often take years to manifest. So it won't be something that happens anytime soon, but getting good strength and swallowing of your, the control of the muscles in your mouth and in your throat here is really important. So working with a speech therapist might be a great idea if you can. Otherwise, there are a number of exercises that can be beneficial here. Okay. So the most basic of some of these swallowing exercises is going to be just called an effortful swallow. So when you do a normal swallow, just want to try a little harder to control those muscles. So You swallow with the maximum effort of all these muscles here, kind of like exaggerated swallowing. And this will strengthen all those muscles generally and the control over those. A little fancier is going to be something called a Masako maneuver or a tongue hold swallowing. In this case, stick your tongue out and hold it between your teeth when you're swallowing. This will increase the strength of the muscles on the back here, of your posterior pharyngeal wall, as it's called. And having that control is going to be another important area of not only will it give you a safer swallow, but that safer swallow means that you're going to have less risk of aspiration, which can be really quite devastating and the cause of pneumonias. You can also just do basic tongue maneuver practices here. So just different movements of the tongue. A big issue, particularly that I actually saw as a when I was in my residency, we would do nerve and muscle testing. It's called EMG, nerve conduction studies. We do the EMG of the muscles underneath your tongue here, because a lot of times those muscles will be impacted by the neurologic effects of that radiation. So these maneuvers to strengthen those muscles ahead of time would be tongue protrusion, retraction, lateralization, and circles. Either way, those maneuvers done enough times, you're going to improve the control of your tongue, your swallow, all those things before any sort of treatment effects can worsen them. Back to the back here, postural training. So working beyond the scapular training I mentioned earlier, again, you want to make sure that the scapular muscles are nice and well controlled here. You're able to appropriately move your shoulder blades in unison. And during normal movements here, when you are pulling on something, you're pulling with your back muscles, not just your arms. And in doing so, you're going to have just normal healthier mechanics of those shoulder blades and avoid any sort of what we call dyskinesis. The dyskinesis that then kind of changes the way that everything is kind of pulling around here, and you can avoid strain on the neck. Posture is going to be just kind of being mindful of these things, of sitting with good tall posture, shoulder blades back here, and being just mindful of these things instead of slowly drifting into our normal golem-like positions when we're on computers. Exercises along with that would be things I mentioned earlier, things like that Y dumbbell elevation like this. When you're doing these, you want to bring your arm up high enough that you feel the contraction here. It seems kind of counterintuitive. Why would these muscles be contracting when you're up here? It's because normally when you lift your arm like this, your shoulder blade would be inclined to pull out. So these serratus muscles are going to contract and pull that scapula nice and tight to your back. And those other exercises I mentioned again are going to be your external rotation exercises, both in this direction and this direction. That's going to be particularly important there. Very underrepresented in our normal exercise regimen. Typically, we're going to be focusing a lot on internal rotation muscles, which is pretty much everything else that's going to be moving your arm around. So presses, pecs internally rotate, rows this way, so lat pull down, that's going to be, again, internally rotating. All those big, strong muscles need a little bit of opposition here, and it's going to be those tiny little external rotators like your teres minor and your infraspinatus muscles. Other good exercises can be something called a face pull. So do a proper face pull, and this is going to be really good for building strength in pretty much all the muscles in your upper back here. So your trapezius, your rhomboids, also your external rotators, the rotator cuff, and lats are involved there too. You're going to set the resistance roughly around eye level, maybe a little higher. Grab with overhand grip and pull this way here. So when you pull this way here, you're going to get the external rotation of the arms, and that's what's, of course, going to work the infraspinatus and teres minor again. Really important for control of your shoulder joint, but also contract all those back muscles. So again, overhand grip, pull this way, and in doing so, you can get a nice contraction of all those back muscles. Pull with your back, not with your arms. So for inspiratory muscle training, you can actually purchase an inspiratory muscle training device, and literally all this is doing is giving you resistance to the breath you are taking. And in doing so, you're going to strengthen your diaphragm and all these supporting muscles. So that the external intercostals is what they're called there. Those are the muscles on the outside of your ribs. So when you take that breath against resistance, you're going to strengthen the muscles, which are really important, again, later when you're dealing with any sort of issues potentially with swallowing difficulties. So you need to make sure you're able to take a nice deep breath afterwards. That could be part of a good cough and clearing out any sort of mild aspirations. It's also just really important, especially if you're doing any sort of thoracic cancer surgeries, just to get those nice, strong, deep breaths afterwards. For colorectal cancer exercises, you're going to want to focus a lot on abdominal strengthening and pelvic muscle strengthening, because the purpose of these is to both preserve core stability and core function, as well as continence of the bowel and bladder. When you're doing abdominal wall strengthening, goes back to what I mentioned earlier. Planks are fine, but likely not the best ones for you, just because they're isometric. You want something a little bit more challenging to your abdominal muscles, obliques, all that stuff. So that rollout is a really good option for that one. Besides the rollout, if you are quite a fit individual ahead of time, pull-ups are great for building that core. I always joke that if you show me someone who can do 10 pull-ups straight, I can show you someone who's probably got a six-pack. Even if you can't see your abs, just because you need to be fairly lean for that, you'll likely have pretty strong abdominal muscles just to control yourself as you're doing that pull-up. For pelvic stability control and just general kind of pelvic muscle control here, same pelvic floor exercises before are also going to be quite beneficial for controlling all the muscles around the pelvis, not just the floor itself. So squats, lunges, deadlifts, those are all going to be very good for also making sure that you have great control of your gluteus medius or TFL, tensor fasciae lata. Those are two of your main muscles that are controlling kind of pelvis stability. So when you're on one leg, you're not dropping your pelvis. And when that happens, you cause a lot of secondary issues with your low back, knees, etc. And if you're doing squats and deadlifts for multiple purposes, there you go. You're already going to be working those muscles pretty well. For thoracic surgeries, it goes back to a lot of the similar kind of concepts we've been discussing already. Respiratory muscle training is really important. This one's kind of obvious. You also want to make sure you have good thoracic mobility. So if you're someone who, as I've been saying several times here now, is constantly sitting at a desk, as most of us do nowadays, you want to maintain good thoracic mobility. So some of these exercises might involve potentially like pullover. So there are machines for this, or if you're feeling really ambitious, you can put your back against a bench, use a dumbbell to kind of literally pull over, and that's going to give you a good stretch there. You can even do things like, pardon the name, dead hangs. This is literally just holding on to a chin-up bar, pull-up bar, and letting your weight kind of give you a nice stretch in every muscle in your body pretty much. If you have a pretty strong grip, then you don't need any sort of assistance. I personally always use wrist straps to help with these because I'm not doing this to build my grip strength. I'm doing this to stretch out my back and my limbs and everything. So I'm using those wrist straps. You throw them over the bar, pull it in tight, supports your grip. And then if I'm really feeling crazy, I'll throw in a little dumbbell between my legs to add some additional weight and get a great stretch in pretty much everything up here and in your back muscles. It's real nice. Generally, this is beneficial for all of cancer prehabilitation, but in particular for thoracic surgeries, really getting good aerobic conditioning as best as you can, of course. There's limitations to everything here. But if you're able to really improve your VO2 max and your kind of base level aerobic capacity with zone 2 training, things like that, you're going to benefit from that monumentally, just because after thoracic surgeries or lung resection and that kind of stuff, you have less of that side of the equation to work with. So if the rest of your body is extremely efficient at dealing with decreased oxygen delivery, then you're going to be in better shape for it. In general, exercise for prehabilitation is going to focus on a lot of core areas, including strength training for a couple different reasons and aerobic training. The strength training, you want to build that muscle as much as you can, as quickly as you can. And this is going to give you that insurance policy against future muscle loss. It's going to improve your metabolic health faster, and you're just going to be able to stay independent even if you have relative weakening after surgery or treatment. There's one aspect I left off with a lot of the strength training, and this is getting a bit on the more advanced side, but if you're able to power type training, explosive type power training, this is going to be really important if you're at risk for falls. So being able to quickly change your positioning or catch yourself during a fall obviously is going to have many benefits in terms of mitigating any sort of risk of injury. So if you're able to or interested, then incorporating something related to moving weight quickly is going to be a nice strategy. To do this, try and find what would be about your 1 rep max on a given exercise. So There are plenty of 1 rep max calculators on the internet there. If you look that one up, pick the exercise, whether it be a chest press, use bench press as the analogous exercise in the calculation, squats, deadlifts, those are the main ones that they use for those. And find out what your 1 rep max is, drop that down to like 30% or so. And then what you want to do is complete the exercise with each rep moved quickly, but deliberately. That's why the weight's so low. You want to make sure you're able to do the rep quickly from the starting position. So, it works well with something like a deadlift where you're going to lift that weight really fast, but you're not risking a lot of injury in the process if your form is good. Bench press, same thing. So the down is slow, but it's the up that's going to be fast. And by doing that, you're going to train your nervous system and your muscles to maintain joint stability and react quickly in the event of a fall or a stumble or something like that. So it's really, really important for safety in that respect. Not 100% necessary if you're not able to incorporate it. Don't beat yourself up and feel guilty about this. This is just icing on the cake kind of thing. If you're already doing strength training, you're going to get some benefit there. And if you're doing aerobic training and balance training, there's only so much time in the week. The benefits of aerobic training, to recap, are going to be related to your body's ability to utilize whatever it gets. So many times after surgeries, even if it's not related to your lungs, but just the effects of anesthesia and all that, your heart is not going to be beating as fast. Your blood pressure is going to be lower. You're not going to be breathing as deeply. All these things can happen that will decrease the amount of oxygen that your muscles and organs are going to be getting. What aerobic training is doing is making your body much more efficient at using what it gets. So in the same respect that if you have end-stage heart disease or lung disease, we're still doing cardiopulmonary training. It doesn't strengthen your heart or your lungs. It just makes the rest of the body really good at using what it gets. I can't say that enough. Overall, all these different exercise styles are going to improve your tolerance of the therapies. They're going to have you bounce back faster. They're going to raise your baseline before you go into any procedures so that afterwards, when you have a little bit of decrement, you're still above your original baseline prehab. So you'd be in a better spot because of it. Thank you sincerely for hanging with me through all those details. Again, please like and subscribe so others can find this resource during their cancer journey. If not already, the next video should be up within a week, and that one will be covering the protocols for sleep, nutrition, and more that I give cancer-fighting gladiators.